All right, let's tackle a classic high-stakes scenario for the PLAB 2 and UK MLA exams. We're talking about the older male patient who comes in with back pain. This case is all about connecting the dots between symptoms that might seem unrelated at first, but together point to a really critical diagnosis. Let's jump right in.
Welcome to this clinical walkthrough on a prostate cancer case for UK MLA, brought to you by Mediate, your 24/7 practice partner.
So, meet our patient, Mr. Davies. He's 65 years old, and his first sentence is just packed with clues. We've got the chronic nature of the pain, a dull character, and this is the important part, his own worry. That worry, that's a clinical sign in itself. It's telling you, hey doc, think beyond a simple pulled muscle here.
So here's our roadmap for this consultation. We'll set the scene, take a really focused history looking for those red flags, then we'll address his concerns and do an exam. After that, we'll pull it all together into a diagnosis and management plan, and finally, we'll touch on the key differentials you need to have in your back pocket.
Okay, first things first, setting the scene. We're starting with his main complaint, and the absolute key here is to be systematic. Let's not jump to any conclusions just yet. Using a mnemonic like Socrates is honestly a lifesaver here. We know it's a constant, dull ache that's been around for 3 months. But look at the onset. He first noticed it just rolling over in bed. That's a huge clue. It points away from a mechanical injury and screams non-mechanical cause. The fact that there's no radiation or weakness is good to know, but it definitely doesn't rule out something serious at this stage.
Right, now that we've got a good handle on the pain itself, we need to pivot to a focused history. This is where we start hunting for the real cause, separating the everyday stuff from the potentially life-threatening.
So, we start screening for those big constitutional symptoms, and wow, we get some major hits. Mr. Davies tells us, yes, he's lost weight without trying, and yes, his appetite is gone. These are massive red flags. The moment you hear chronic back pain plus unexplained weight loss in a 65-year-old, malignancy has to shoot to the very top of your list.
So why is this combination so incredibly important? Well, because these symptoms just scream systemic illness. Simple mechanical back pain doesn't make you lose weight. This forces us to think bigger, and in a man of his age, the prostate becomes a prime suspect.
And now we directly link that back pain to our suspected source. We have to ask about urinary symptoms. Let's break them down. He's got storage symptoms, frequency, urgency, getting up at night, and voiding symptoms, a weak stream and that feeling of not emptying properly. Connecting these lower urinary tract symptoms, or LUTs, with those big red flags, that is the absolute key to cracking the station.
And then, just when you think the case is already strong, you get this final critical piece of the puzzle, the family history. His uncle had prostate cancer. You know, this significantly boosts his personal risk and really solidifies our suspicion. Seriously, never ever forget to ask about family history of cancer.
Okay, we've got a powerful history. Now we need to address the actual person sitting in front of us and gather some physical data. This is all about blending our clinical skills with top-notch communication.
Exploring the patient's ICE, their ideas, concerns, and expectations, is not just some box-ticking exercise for the exam. It is vital. He's worried about cancer because his friend had a bad experience. Acknowledging that fear directly, validating it, that's how you build trust. He just wants to know what's wrong, and we need to show him we're going to figure it out.
Now, for the physical exam, consenting for a digital rectal exam has to be done with clear, empathetic language. This phrasing here is just a perfect example of how to do it. And remember, you might find a hard, nodular prostate, which is a classic sign. But, and this is so important, even if the exam feels completely normal, your suspicion must remain high. In this case, the history is king.
So, we've gathered all our information. Now comes probably the most critical part of the entire station, putting it all together into a safe, clear, and actionable management plan. Now, you have to explain your suspicion to the patient. Use simple, everyday language, no medical jargon. This slide here gives you a perfect script. Explain what the prostate is, what cancer means, and then, and this is the key, directly link it back to his symptoms, the back pain he feels, and the urinary changes he's noticed. This is how you deliver serious news with real clarity and compassion.
Your management plan has to be immediate, and it needs to have these 4 parts. 1. Address his pain right away. 2. Arrange urgent tests, a PSA blood test and a back X-ray. 3. Make that urgent 2-week wait cancer referral to urology. And 4. The crucial one. Provide crystal clear safety netting advice. Ticking these 4 boxes shows the examiner you are a safe, competent doctor.
Now, knowing these steps is one thing, but delivering them confidently when the clock is ticking in an exam setting is a whole other ballgame. To help with that, you can practice this exact case right now and get objective feedback on mymediate.com.
Let's just zoom in on that safety netting for a second. This isn't a vague, oh, come back if you feel worse. No way. You have to be super specific about the red flags for metastatic spinal cord compression, which is a massive neurological emergency. He needs to know in no uncertain terms to go straight to A&E if any of these things happen.
Finally, to really show the examiner you're thinking at a higher level, you need to talk about your differentials. You need to know not just what you think it is, but why you think it isn't something else. Let's quickly run through the main ones.
This table lays it out so clearly. Look at benign prostatic hyperplasia, or BPH. Yeah, it gives you urinary symptoms, but it does not cause weight loss or metastatic bone pain. Then you have prostatitis, that's urinary symptoms plus things like pain and fever. You see, it is this very specific combination of urinary symptoms plus those constitutional red flags like weight loss and bone pain that points straight to metastatic prostate cancer.
So if you remember just one thing from this whole walkthrough, please let it be this. In an older man, one urinary symptom plus one cancer symptom like weight loss or new bone pain, that equals an urgent 2-week wait referral, period. Don't second guess it. It is the safest and most important thing you can do.
You can practice this exact case now on mymediate.com.